Maintain a healthy weight. Being overweight or obese increases the risk of fatty liver disease, which can lead to liver damage. So, it is important to maintain a healthy weight through regular exercise and a balanced diet. Avoid alcohol. Excessive alcohol consumption is one of the leading causes of liver damage. Therefore, it is best to avoid or limit alcohol intake to keep your liver healthy. Eat a balanced diet. Consuming a balanced diet rich in fruits, vegetables, whole grains, and lean protein sources can help keep your liver healthy. Avoid processed foods, sugary drinks, and saturated fats. Stay hydrated. Drinking plenty of water can help your liver flush out toxins and maintain optimal liver function. Limit exposure to toxins. Avoid exposure to toxic chemicals such as cleaning solvents, pesticides, and other harmful substances that can damage your liver. Get vaccinated. Vaccinations for hepatitis A and B can protect your liver from infection and damage. Monitor medication use. Some medications, including prescription and over-the-counter drugs, can damage the liver. Therefore, it is important to follow dosage instructions and to consult with a healthcare provider before taking any new medication. Manage underlying health conditions. Certain health conditions, such as diabetes and high blood pressure, can increase the risk of liver damage. Thanks for watching.